Hello, I'm Dr. Charles Gardner, Medical Officer of Health with the Simcoe Muskoka District Health Unit, here to provide the COVID-19 update for Simcoe Muskoka. I would like to begin with providing condolences. We have had a death in Simcoe Manor, and I would like to provide condolences to the family members for your loss. So as of this morning, we have a total of, on our website, 956 cases. This is an increase of 72 cases from when I last reported to the media on September the 29th. However, we actually have some additional cases that need to be included in that tally, that will be included in that tally by tomorrow, and that's an additional 8 cases from Simcoe Manor. So if you add that, in fact, we've had 80 cases since my last media scrum a week ago, giving us a total of 964 cases. So far this week, we've had, including the missing cases, a total of 46 cases that are new. And 23 of those were through the weekend to Monday, and 23 of those have been since that time today. So if we look at the 15 most recent cases, if we look at the last 24 hours, I spoke to 23 cases, but 8 of them have yet to get entered into our data system. So therefore, I'll talk about 15 that are in our data system. 9 of them are related to Simcoe Manor as an outbreak, and their ages range from between 65 and 79 and 80 plus. We also have 6 sporadic cases. We've got 10 women and 5 men. And if we look at where they reside, they're all residing in Simcoe County. We have 1 that's community acquired, 1 that's a close contact, 9 that are from institutional outbreaks, and 4 that are under investigation. Presently, 14 are self-isolating and 1 has recovered. So we've reported a total of 185 cases in September. And if we consider that number, you have to go back to April or May during the peak of the first wave to see that number, that many people in a single month, just to give you a sense as to how big the wave was in September. It really takes us back to the magnitude of what we were facing in the first wave. If we compare the week of September the 27th, we had 75 cases in that week, and that's slightly higher than the largest number of cases that we had at the peak of the pandemic in the first wave, which was during the week of May 3rd. So those 2 weeks, if you compare them side by side, are very similar in terms of the total number of cases. But other than that, they're actually very different in profile. The first wave back in May, the average age was 54 years, and the week of September 27th, the cases age average was 32 cases. So much younger. The profile of the people that we're seeing affected in this wave are much younger than the first wave. We note that a much higher proportion of the cases in the first wave were related to outbreaks. So half of the cases, 49% of the cases in that week in May the 3rd, were related to outbreaks versus about 1% of the cases that we've had in the week of September the 27th. So another major difference is that the cases that we're seeing now are out in the community rather than in institutions or part of institutional outbreaks. We also note that in the first wave, 60% of the cases were women, and in the second wave, during the week of September the 27th, 60% were men. that may be related to the environments that are affected. So in the first wave, we had a lot of institutions affected and long-term care facilities that were affected. And so there's a predominance of women who work or reside in these facilities. And now we're seeing outbreaks affecting other work environments and social environments, social interaction, and also housing with young people living together who aren't related, living together in housing and being students and being workers. So therefore we're seeing a different profile with regards to gender as well, more of a male dominance. Another way in which things are different is the percent positivity of the test results is much lower now than it was in May. So the percent positivity in May was 3%. The percent positivity now is about 0.3%. This percent positivity is a measurement of a combination of how many cases you're having versus how many tests are you doing. So we're having a fair number of cases, but this also really means that we're doing much more testing now than we were back in May. And so it's possible, in fact likely, that we're missing fewer cases now than we were back in May. Probably we had actually more transmission happening in the community in that first week of May than we were in this last week of September, even though the case count is the same. So at this point, very different scenarios, I would say, with the two waves. It may be that, in fact, we're just witnessing an earlier portion of the wave this time because we're doing a lot more testing. We've been fortunate that we've not had a lot of long-term care facility cases to date, but that, of course, is changing, as you will see from the report that I'm going to give. And we do know that the risk for long-term care facilities goes up when you have more transmission happening in the community, that you're more likely to have it then happen in a long-term care facility. And of course, we very much want to avoid that because of the great risk that presents to the health and the lives, in fact, of the people that reside in those facilities. This takes us right back to the importance of controlling transmission in the community now. All the way along, I've been saying that people need to do what they can to reduce transmission, protect themselves and protect others. And this means on a day-to-day basis that you are physically distancing from people out of your immediate home, that you're maintaining a 2-meter distance from other people, that you're hand washing, that you're self-monitoring if you have any symptoms, that you're self-isolating and seeking assessment and testing, and that if you're in indoor public spaces, you need to be wearing a mask. The province now is requiring masks if you can't distance and you're in a work environment other than a public space. And I would suggest that if you're outdoors and you cannot physically distance from people, you should be wearing a mask or face covering as well. So all of that is really important if we're going to flatten the curve again and bring this under control again, to safeguard those who are most vulnerable, older people, people with pre-existing medical conditions, people that live in long-term care facilities who are very much at risk. The number of cases that we had in Muskoka is actually down to 4, which is certainly good. It had been elevated to 11 the week before, which was the highest count that we'd ever had in Muskoka. So certainly that's a good thing. Right now we have a total of 87% of our cases that have recovered. So that's 835 cases in total that have recovered. So our mortality figure right now is 39. We've had 39 deaths. As I'd indicated, we've had a newly reported death that I'd spoken to at the beginning of my report today. Right now, according to our data, we have no hospitalized cases. I've had a verbal report from my staff that there are actually 2 cases from Simcoe Manor that are now hospitalized, but that's not in our data as yet. We have a total of 79 individuals who are self-isolating, and we have a total of 13 who are isolating within their facilities. So with regards to outbreaks, currently we have 6 outbreaks, which is up from 3 when I reported last. So the Pines in Bracebridge with 2 staff cases who reside here, which is unchanged. IOF, 1 staff member as a case, and at Simcoe Manor in New Tecumseth we have a total of 28 cases, 7 staff and 21 residents, and of course an ongoing investigation. I'll get into more detail on the long-term care facility outbreaks in a moment. With regards to other work environments, we have a manufacturing facility, an agricultural facility, and a construction site, and each of those have 2 staff who reside in Simcoe, Muskoka, who are cases, and otherwise are carrying out investigations and managing those sites, including testing of the people that work at those sites. And I'll provide a bit more information about that in a moment. Our schools, we have no school outbreaks, no evidence of transmission in any of our schools, but we have had 15 situations, 15 schools in which there's been a staff member or a student who've come down as cases that have resulted in some exposures requiring isolation for students and staff at those sites. So that has resulted in nearly 550 high-risk contacts being investigated and monitored, individuals on home isolation and for follow-up for testing. 480 of those are individuals within the school environment, and another 60 are within the home environment or community contacts of those from those individuals. The 15 cases that I'd cited with regards to the schools. There's been concern about lab turnaround time. So indeed, we've had challenges with that. Throughout the province, they've had challenges with that. The target is for a 2-day turnaround time or less, 80% of the tests within 2 days, and we are not achieving that turnaround time, as I'd cited in my last report a week ago. This is in part related to the backlog of testing happening in the provincial public health system, public health laboratory system. With regards to the direction of our cases, we have had some increase in the incidence compared with the previous week, given that we have more cases than we had in the previous week. We are still less than half of the incidence for the province as a whole. The province's rate has gone up to 21.5 from the previous 16.4. And our reproduction number is presently 1.2. So anything above 1 indicates that we're increasing in our pandemic, that it's growing, which of course is consistent with increasing case counts. A bit more information about our outbreaks. Simcoe Manor, I've already indicated a number of cases among staff and among residents. I've also indicated that I've had verbal report that 2 are hospitalized, that we've had 1 death. Otherwise, we are conducting an investigation working with the Central Region for Ontario Health, with paramedicine services, with Stevenson Memorial Hospital, in order to arrange for support, resources, staffing, to help with the investigation, to help with regards to an infection prevention and control assessment. And testing is being done. Most of the residents were swabbed 3 days ago with results pending, so October the 3rd. And staff are also undergoing testing. We, with regards to the other 2 long-term care facility outbreaks, I've already cited the number of staff or residents involved in those facilities, and testing has been conducted in those facilities with results that have come back as negative. So we continue the management of those 2 other facilities. And to be specific, IOOF and the Pines. With regards to the workplace outbreaks, I had already indicated that we had a manufacturing site with 2 individuals who were tested positive and others who are undergoing testing and follow-up. We've also got a construction site, and I'd indicated that there were 2 cases that were from our area, but in fact there's 1 additional individual who was tested positive but does not live in our jurisdiction, and so that individual will not be showing up on our data. But just to be clear, 2 from within our district and 1 that is from out of district. And then with regards to a agricultural site, agricultural processing facility in Simcoe County, I've indicated that we had 2 cases that were from within Simcoe County, but in addition to this, we have another 3 individuals who are cases, workers who live out of Simcoe County, so they too will not be showing up in our data. They'll be showing up in the data of the health units in which they reside. So, turning to our key media messages that we have for today. One is that we're putting out a health facts as an alert about the surging cases that we're having, how we're continuing to increase week by week in the total number of cases. So area healthcare providers will be receiving this alert. We'll also be putting out an alert in our weekly communique to our partner agencies with this same message. I'd be reinforcing in that the importance of the control measures that I've cited earlier in my presentation today. The province last week issued an updated COVID model projecting cases in the province and the potential for different outcomes with the present wave, the second wave, noting that there could be a severe outcome with over 1,000 cases a day by early to mid-October that would be more akin to the experience that was that happened in Victoria State of Australia. And in that scenario, there would be the potential for a very heavy hit or draw on our intensive care unit resources. So, that is certainly a critical thing for us to avoid by flattening the curve with our collective efforts together in avoiding transmission, and certainly something for the healthcare system to be prepared for as well. There are lower scenarios in that as well, in that projection, and if we're very fortunate and work very hard together, it is possible for us to achieve those lower scenarios with a less severe outcome. We will be issuing a dashboard very soon on our website that will be connecting from our health stats page, and it will provide at a glance an image of how we're doing with a color coding for how well or how poorly we're doing. So basically a green, yellow, and red demarcation about how we're doing. It would be looking at the transmission of cases that are occurring, the basic epidemiology of transmission in our district and the direction of it. It would also be looking at our own capacity as a health unit and the turnaround time for testing and our ability to follow up with cases. And finally, it would also be looking at the impact on the healthcare system and draw on admissions and ICU admissions, intensive care unit admissions. So please stay tuned for that. That'll be coming. I think that'll be helpful for people to see at a glance and interpret just how we're doing and help with our communication to the public as well. We're also putting up, we do have up, in fact, a visualization of a community cluster of cases, just to give you a sense as to the complexity of the cluster investigations that we do and the way that transmission takes place in homes and then in the community and then in workplaces. And so if you have a look at our website under COVID-19, you will find it located. Basically, if you look on Connect to COVID-19 and scroll down, you'll see something called a local example of how COVID-19 can spread easily from person to person. And it basically demonstrates it in this situation. We were dealing with an outbreak that connected two different communities and 4 households, and 2 workplaces, and then other individuals in the community as well. And that multiple people within those households were either infected or became contacts that had to be in isolation, and same with individuals in those work environments. So I think it really is meant to drive home the point that people need to be careful when they're out in the community or at the workplace. Be careful with the physical distancing, with hand washing, with face coverings, and certainly with self-monitoring and isolation as well. That you want to avoid being part of this kind of chain of transmission and affecting the people in your lives. So we've had some challenges with regards to some individuals abiding by our direction with regards to isolation as cases or as contacts. And we've had to issue orders in some instances under the Health Protection and Promotion Act requiring them to comply. And this has happened frequently enough for us that we're now proceeding with issuing a class order under Section 22 of the Health Protection and Promotion Act to the community, to everybody in Simcoe, Muskoka, indicating basically that if you are a case or potential contact, or if you have symptoms that indicate that you might be a case, that you need to isolate in your home. In the case of an individual who has symptoms and is a case, would need to isolate for a 10-day period, because we now have been instructed by the province to regard that as being the period of communicability, the period in which you can transmit that infection to others. It used to be 14 days. It's been downgraded to 10 with more research to support that. So for those who are potential cases, they should be isolating for a 10-day period. For those who are contacts of cases, that you need to be in isolation for 14 days. And then if you develop symptoms, you need to remain in isolation and also follow direction with regards to testing. So this applies to everybody now. If you live in Simcoe, Muskoka, or are in Simcoe, Muskoka, and you end up being either a case or a contact of a case or a potential case, that you need to abide by this order. We also are challenged with our ability to keep up with contact management, contact follow-up. We have such a large volume and a rapidly increasing volume of not only cases, but especially the numbers of contacts that we're unable to keep up with all of the contacts. And City of Toronto Public Health last week issued a declaration that they were unable to keep up with this and they needed to refocus their resources to manage those situations that were highest risk. So they were focusing on their cases and they were focusing on the contacts that were outbreaks. And so we are doing something very, very similar. We are following up with the cases. We are following up with contacts that we deem to be particularly high risk situations for transmission, such as outbreaks. We are otherwise going to be asking cases to follow up with their own contacts if they're willing and able to do this, and advise their own contacts that they need to be in isolation for a 14-day period, and advising for follow-up for testing. Certainly individuals can call us for follow-up information if at any time they receive such information from a person that they know and they want more information. But at this point we're going to be relying on that type of approach. If we have cases who feel they cannot or are unwilling to do that kind of follow-up, we will do the follow-up with the contacts. We're also going to be working closely with the schools with regards to the school exposures. The schools already and school boards do email and telephone communication with contacts of cases, so we'll be giving very close instruction to the schools so that they would be carrying out that messaging, and otherwise we'd be relying on that as a means of communication rather than directly from ourselves. And once again, we would certainly take calls back from any of those individuals with questions, but the first point of contact would be from the schools. And we're using a service from Public Health Ontario to help augment our contact management capacity, so that they will be doing some of the outreach as well to contacts for us. So all of this is meant to ensure that we can continue to do the very best in helping people who are certainly cases but also contacts know what to do. We just need the help of others to be able to do it. We are unable to keep up with it all ourselves. This, we hope, is a temporary thing. I anticipate that we'll have more cases before we have less, that the case count will go up before it comes down. So I think it'll be quite a while before we'd be able to back away from this type of an approach, but this is what we're embarking on at this time. I'm also pointing out that we are recruiting more staff, in part because of the staff that were pledged to us by the province for the management of the opening of schools. So we have hired quite a few nurses and will continue to do so. So hopefully that will help us with this situation. But at this time it is insufficient, and we do need to embark on this alternate approach. Another way in which we are challenged is a limited ability to be able to provide our other programs, and that includes in schools. So in the spring we were unable to finish the grade 7 vaccination program, and that was because the schools were closed, and also because our staff had to be redirected to do case and contact management in response to the first wave. So we intend to catch up with those vaccinations with that group of students. They're now in grade 8, so we will be providing vaccination for those students in the fall. We anticipate doing it by clinic appointment at our offices or possibly in other locations in the community in order to allow the students to get caught up in their vaccines. The students who are now in grade 7 normally would be receiving their first dose of these vaccines in the fall. We will not have the capacity to do that, and that will have to be postponed until late in 2021, in which case we will do it at the same time that, by then they'll be in grade 8. We'll do it at the same time that we'd be doing the new grade 7 students. So we'd be doing 2 years together in a year in order to catch up with the inability to be able to vaccinate those children now. So you can see that there are certainly challenges for us related to resourcing. I would also point out that normally we do vision screening in schools. We normally do oral health screening in schools, and we will not be able to do the vision screening in schools, and the oral health screening is going to be delayed into the new year. So I have a couple of media questions that I'll address as follows. Simcoe Manor outbreak, do you have the latest numbers and statistics from Simcoe Manor? Have you confirmed whether, it says here, have you confirmed whether the second death from the weekend has been confirmed as COVID positive? Is testing completed inside the facility, and how often will people be tested? So I'm just going to pull up my stats again on this and say that earlier I'd already reported with regards to Simcoe County or Simcoe Manor. I would say that, as I'd indicated, we've had one laboratory confirmed case of COVID-19 in that facility who has passed away. We have actually 2 other situations where people have passed away that were awaiting laboratory confirmation. So at this point, we are not categorizing them as cases, but we are awaiting laboratory confirmation. And otherwise, I do believe I've addressed the questions. I cannot answer the question about testing yet with regards to the staff or the residents in that facility. We are still conducting an investigation with regards to Simcoe Manor. The outbreak was declared on October the 2nd, so okay, here I have a little bit more data for you. Out of the 126 residents that live in the facility, 121 of them were swabbed on October the 3rd, and we're awaiting the results. I don't have any information specific to the staff. So no doubt they are being tested on a regular basis, as are all staff in long-term care facilities. I don't know when they were last tested. We will certainly are, in fact, following up with regards to further testing, as well as an assessment of the facility to determine other measures that are required, and also pursuing ensuring that they have sufficient staffing resources to be able to operate safely, working in partnership with Simcoe County EMF, Emergency Management Services, EMS, and also Stevenson Memorial Hospital. So I do have one more question from the media, and that is, have any positive tests been traced back to the car rally in Wasaga Beach? And my answer to that is we don't have any test results that would be linked overtly, explicitly to that situation. And it's quite possible we never will, because the individuals involved, many of them were from out of district, would have gone back to district. We don't have a spike in that immediate area that among the people that live there that would be related to that, but it's possible that it's a bit too soon to see that anyway. You can get a delay of 14 or more days. Okay, so at this point I'd be happy to take questions.
Okay, thanks very much, Dr. Gardner. And just a reminder to whomever is typing, if you could please mute your phone, that'd be really helpful. So let's start with Erica Engel. Do you have a question for Dr. Gardner?
Yes, thank you. My question is related to you're not able to follow up with all the contacts at this point, but you did manage in the first wave. So maybe you could speak to what's different about this time that has created the additional challenges for you.
That's a very good question. The main difference is the number of contacts per case is enormously higher. So with the first wave, there was essentially the shutdown of the economy, and that greatly reduced the amount of movement that people participated in. There was a great shutdown in public gatherings and public venues, and therefore the number of contacts per case was much less than it is now. This time we had the opening up of the economy, we had people going back to work, certainly people going back to school. With the school cases in particular, you can have 30 or more contacts per case because it's an entire class or more, and each contact is a significant amount of work. If you have a vastly increased number of contacts, then it becomes unsustainable for us to be able to follow up with them all with the staff that we have.
Okay, and as a follow-up to that, as Thanksgiving approaches and there's more and more messaging that says you have to stick to your household now, there are people upset thinking, well, you know, my kids can go to school, maybe I'll just like have family dinner at a bar since they're open, but you're not allowing family gatherings. So maybe you could speak to the difference and the method behind restricting, you know, informal gatherings or family dinners, but not restricting, like not shutting down the economy and work and school.
Yeah. Well, first off, we regard school to be a really important priority to keep open. And I would point out that although we've had quite a substantial number of exposures in schools, we've had no transmission. And that is actually consistent with research showing that it's less transmissible in children, and also because of all the control measures that have been put in place in schools to reduce the risk of transmission. And we're hopeful that it remains that way. Certainly we continue to monitor it closely. So it's really important to keep schools open. It's important for the mental health and well-being of children. It's important for their education, and it's important to support families so that they can continue to go to work, which is critical to their well-being as well, for income and other reasons why work is important for health. So we do need to give a priority to that. I agree with you that there would appear to be incongruity with gatherings elsewhere, such as at bars and restaurants. We've always, when it comes to the business of getting together for Thanksgiving and people gathering in homes, we are advising that you stay with your home group, with those that you live with. It's not actually a legal requirement. It's not actually enforceable. So that would be another key difference. If you chose to have other family members over to your home, you're going against advice, but you're not actually going against a regulation that's enforceable. So I think that that's an important thing to keep in mind. It's not that we're disallowing it. We're advising against it strongly, but only advising against it. If you go out to restaurants, I think it's important that you do so at the table with people that you live with. I think the advice would carry out there as well. You're to only have close contact, according to our advice, with household members, or if you live alone, one other household member that you would essentially adopt to avoid loneliness. So if you're going out to a restaurant or a bar, you should really be applying the same thinking, that you're physically distancing from everybody else, and that the close contact at your table are the people that you live with. And it's possible that the province may change these things to come, that there could be more restrictions with regards to these social gathering sites in the community, these other elements of the economy. So we shall see. Anyway, I do think it's very important that people take to heart right now the importance of physical distancing from everybody apart from those in your household.
Okay, thank you, Erica. James Fuller from Coach will use a question.
Yeah, thank you. Dr. Gardner, I just wanted to ask a bit more about new enforcement.
So I guess this would be with regards to my order. Just checking to see if that's the context of the question. Yeah. So an order under the Health Protection and Promotion Act can only be enforced by public health personnel. It cannot be enforced by bylaw officers or police. So it would be for us and us alone to enforce. And basically, I think it would be a matter of when we encounter situations where an individual is a case and they have violated this order, then we could proceed with other legal means within the Health Protection and Promotion Act, including seeking a court order, which is sort of the next level of action, or applying a fine, which is another level of action that we can do within the Act. But it would be for us alone to be enforcing this.
So just to follow up on that, primarily you've sort of said in the past that the role you've taken is more of an educational stance. So I understand that you put this in place to nip this in the bud in terms of people, breaking these rules. Can we expect a pretty high enforcement on this? Are you really going to push this hard, or is it going to be a bit of a mix still?
Every situation we're going to assess. We're going to, what we want at the end of the day is compliance, right? So we felt we needed to have this in place because we weren't getting compliance on a fairly regular basis, and wanted to take this additional step to see if it would help us with compliance. If we're finding that we've got situations where people aren't complying, we do have the option to do those additional steps of enforcement. But at the end of the day, if we can do it through education, we found that in fact they just weren't understanding. If there was a language barrier that we needed to overcome, then we wouldn't be issuing enforcement means. We'd be relying more on the education means. If we're finding that they're willfully non-compliant, then we'll enforce.
Thank you.
You're welcome.
Thank you very much, Jean. Chris Simon from the Barrie Advanced Youth question.
I do. Thank you very much. Dr. Gardner, on that point, how enforceable do you think that this order is, considering the staffing shortages you've alluded to earlier in this press conference?
It'll be a challenge. It'll come down to one-on-one basis. Although it's applied to everybody here, at the end of the day, we'd be dealing with individuals that we identify who are cases or high-risk contacts, and on a one-on-one basis, we'd have to be deciding whether or not we needed to use this to enforce. And we do note that the great majority of people comply without the enforcement. This is meant to help us with those few who disregard what we require.
And the province's move to appointment-only testing, is that, do you worry that the health unit may miss out on some cases that we're hearing about, instances where people have to wait days for an appointment at this point?
It's a very good point. We obviously want very easy access to testing for people who have symptoms or are a contact of a case or part of an outbreak. And so it's going to be a challenge to our ability to help everybody avoid transmitting to other people if they can't get that testing done. So it'll be a very good thing when the province can overcome that difficulty. And what I would say is that if there are people who have symptoms, and we are advising that they self-isolate and that they seek testing, but if they find they can't, that it's greatly delayed, they need to continue to be self-isolating. That's the really key thing. If they can't get a test, the bottom line is they need to be self-isolating. And with symptoms now, it's 10 days. And you need to be also without a fever and recovering from symptoms after that 10 days before you can come out of isolation.
Thank you.
Okay.
You're welcome.
Thanks, Chris. Allison Brownlee from Muskoka Region Youth question.
Yes, thank you. I also had some questions about the testing restrictions, so thank you for those responses. Follow-up, though, do do you worry that your latest self-isolation order may dissuade people from seeking testing?
That's a good question, but to me, like I said, really the critical thing is that they isolate. Testing is helpful and important. It certainly helps us to have the statistics to know what's happening with the pandemic with positive tests, and it helps us to then pursue their contacts. But the really critical thing is that people with symptoms self-isolate. So I would hope this wouldn't dissuade them. It's at the end of the day, if people comply, then there's really nothing punitive about it, we would only be enforcing for those who aren't complying, who are basically willfully disregarding what we were requiring of them. So I hope not, but I think in fact you raise a good and interesting point. There can be undesired outcomes with any action that we take. That is a possibility.
And also in your release this afternoon, the health unit did mention that the order would be in place until the health unit deems fit to lift it.
Yeah.
What conditions would need to be met before the health unit decided to lift this order?
Well, certainly it would be lifted when the pandemic is over, at the latest, right? Now that can be a long time. That can be a year or more, right? I think we would be keeping it in place for the entirety of this second wave. At the end of the second wave, it'd probably be a good time for us to review again many things, including whether or not we need to keep this order in place.
Thank you very much.
You're welcome.
Thank you, Allison. Ross is fine from CTV. Are you on the line? Do you have a question? Okay, we'll come back to Roger. Adrian Procedia, do you have a question?
I do, actually. Thank you. My question is in regards to the grade 7 vaccines. Is there any harm in delaying the grade 7 vaccines? Like, will they be any less effective if they're given later?
Thank you for the question. They are effective if given later. There's no reduction in effectiveness. I think the risk would be that they don't have protection from those diseases until they're vaccinated. So we're talking about meningitis and then two forms of viruses that are transmitted primarily sexually. And so the later we leave this, the greater the potential for disease transmission among that cohort of students. So we obviously don't want to leave it too long. We wouldn't want to leave it late into high school, for example.
Follow up then, can parents take their children to a clinic or to the family doctor to get these, or are they only offered through the elementary schools?
We would certainly support family physicians who might want to provide these vaccines to their patients. So that indeed would be an option. Otherwise, we are going to strive to our very best ability to make it available readily at clinics in the fall.
Okay. All right, thank you.
You're welcome.
Ian McLennan from Barrie 360, do you have a question for Dr. Gardner?
Most have been already asked, but I guess Dr. Gardner, one with regards to the contact follow-up, the need for more resources and what have you. At first blush, maybe from some people's optics, it looks like, I'm not blaming health unit, but that the control or how we're managing the second wave is maybe a little not out of control, but different than the first wave, struggling to keep a handle on things. Is that an overreaction, or is that a path we could be heading down?
I take it very seriously, this second wave. I think if you look at the projections from the province, there's definitely the potential for this to become severe, to have a spillover effect that would involve high-risk populations, affect long-term care facilities, potentially have then the mortality, hospital admission, ICU admission. That potential is there. We need to take this very seriously. Obviously, we're struggling right now as health units to be able to keep up with it with the case and contact management. It's become far more complex in terms of the pattern of contacts and the way that the transmission's affected multiple homes, multiple communities, multiple workplaces. To me, I think it's something that we absolutely collectively have to strive to bring back under control.
Thank you.
You're welcome.
Thank you, Ian. Mark Claremont from Muskoka today. Do you have a question?
Yes, again on the order today, exactly how many violators have you had? And also, how do you tell the compliance doctor, and is there a snitch line for people to call?
I'll get back to you with the exact number. I'd rather do that if I could. We know because we find out that in these instances we've had people who've had test results and then we follow up with them and we find they're not complying with the requirement to isolate, that they might be still working, for example, or their contacts. We find that they aren't isolating, they're continuing to work when we follow up with them. The value of us being able to follow up with people is to make sure that they're still isolating to avoid transmission. So, I mean, to me, that's one of the concerns about us not being able to keep up all the contact tracing the way we've been able to do it to date.
So you don't want people to call and say, I know my neighbor has it, and they're not self-isolating. You can also just add, today's 15 count, you say there's 8 more on top of that?
Yes.
Oh, yes?
Yes, we have an additional 8 that haven't been entered into our data system yet that we're aware of that will be entered.
Yes, that's 23.
Yeah.
But that snitch line thing, you don't encourage that, do you?
Well, we certainly are available to receive calls from the public about anything, any question or concern, and we've certainly had people raising concerns about business environments or work environments where people haven't been complying with the requirements for face coverings, for example. So we would, or we've had calls about people concerned that somebody hasn't been complying with quarantine requirements when they've come back from international travel. And we follow up with them to the best of our abilities. So if somebody wanted to call concerned about an individual who they think is a case and not complying, we'd be happy to receive the information.
Great, thanks.
You're welcome.
Thanks, Mark. We'll just go back to Roger Klein from CTV. Are you on the line and do you have a question? Okay. Would Don Huddlestone be with us today from the Muskoka? Okay, is there anyone else on the line I may have missed?
Yeah, it's Brandon Piper from Muskoka. I'm here.
Hi, Brandon, do you have a question?
Yeah, Kathy, it's just a short one because most of my questions were asked. Hope you're well, Dr. Gardner. Just noticed on the case count yesterday there were 2 cases out of Gravenhurst, and today there's only the 1. Was that a false positive, or what's the deal there?
Offhand, I don't know. Sometimes we can have false positives, or we can, when we do a review of the data, find out that in fact they didn't meet the case definition and come off as a case, or possibly they've been misallocated as to where they live. So it's been a fairly common thing throughout the pandemic for us to occasionally have to remove a case. And other than that, I usually don't want to give away too much information about individual cases because we have to protect identity of people.
Fair enough. Just one other question. I know you've kind of been hammering at this one, but last week, obviously, we were kind of discussing holidays upcoming, and there was a survey that came out today by Ledger and the Association of Canadian Studies that discussed whether kids should go trick-or-treating this year and whether families should be, having Thanksgiving dinner. What is the health unit stance on that going to the weekend?
I think no matter what the occasion, people should be abiding by a recommendation that they stick to their household for close contact. If you live alone, adopt a household to be the one that you stick with for close contact. And otherwise, you should be physically distancing from people, preferably outdoors even, to reduce the risk. So if you apply that to Thanksgiving, you'd be having your special dinner with your household. If you're seeing other people, it should be physically distanced and preferably outdoors. And when it comes to trick-or-treating, I do anticipate that the province is going to come out with guidelines about how to do that, and it's basically employing those same approaches with regards to the children keeping their distance from other people at their doors, having candy out so that they don't have to be in direct contact or within 2 meters of the children that are arriving. There are a variety of other recommendations that I've seen out of Alberta that speak to the potential to have a costume that allows for a face covering for additional protection and good hand sanitization, of course. But I do expect that the province is going to be coming out with recommendations about Halloween, and hopefully very soon also specific to Thanksgiving.
Fair enough. Thanks, Dr. Gardner. Appreciate it.
You're welcome.